Good afternoon, everybody. I am Tammy Mitchell, and I work with the public health nursing team for the last 7 years as a public health nursing supervisor, and also I supervise the CradleME referral team. And I'm excited to come here and talk about how we support families living with substance use in our roles as a public health nurse, and also to just review the CradleME form and the work we do with partners within the Maine CDC, DHHS, and in our communities. Thank you. The next slide. A lot of folks wonder, what is a public health nurse? This is our goal really is we're a group of professional nurses that are here to improve, preserve, and protect the health and equity of all the life for Mainers. And basically our mission is right there. I'm not going to read everything. What's most important for you to understand is we are a division of the Maine CDC under the direction of Dr. Va. We're registered nurses with all different specialties coming to do this work. Our work is both at the individual and community level. We meet folks in their home. We teach at community or attend community functions. And we also will meet people in a private location if they don't want us in their homes. Next slide. So we have 8 districts across the state. When we're fully staffed, we have 50 public health nurses. As I previously said, right now we're going to focus on the work that we do for maternal child health. And basically, we're focusing on assessments and addressing any of their needs. We partner with families at times for one visit. It could be prenatally with the mom and they don't want us to return. It could be one visit when the baby is born. But the visits are usually, they're all voluntary. So it's completely up to the family about how we're going to visit with them. Next slide. So public health nurses have a varied role in our state. And here, these are just to bullet a lot of them working with maternal child health, of course, and then communicable diseases, our tuberculosis program, and all kinds of other work across the state other than maternal child health. Next slide. So get into a little bit of detail about the public health nursing. We've recently been trained for peri-mental health services to identify and support folks living with postpartum depression or living with mental health illness. We were fortunate to receive this training, and we're looking to have some of our nurses certified in this. This is very important that we are able to better screen that, identify it early, and get families the help. We also support and educate new moms on the Eat, Sleep, and Console model, which is what the hospital staff are doing once the infants are born. So we continue that teaching with the families, the foster parents, the grandparents, the caregivers. We talk and teach about drug safety in the homes. We can provide lock bags when it's appropriate. And we work very closely with the Office of Child and Family Services. And as public health nurses, we're promoting the Plan of Safe Care prenatally. If any of you don't know about the Plan of Safe Care, I'll talk about it a little bit more, but this is helping our families be prepared when the infant is born. Do they have all the services they need in place? We're all a big part of making sure that happens. Our next slide. These are our roles with the families. We are doing the physical assessment, the mental health assessment. As listed here, we're focusing on warning signs for preterm labor, their mental health status, vital signs. And when they come home, we monitor their infant for weight checks, vital signs for mom and baby, and then any signs of postpartum complications. All of our nurses that work with maternal child health families are certified lactation counselors and can offer in-home feeding support. Just to add, on top of that, we also are assessing any other needs they may have. So we're often maybe the only discipline they chose from the CradleME form. And as we see, they may have long-term needs beyond our capacity or specialty. We may refer them to other programs on the form, and we'll get into that as we go further. Our next slide. So, and this is continued. Some of our outreach and education, we are outreaching to all referents in our communities across the state about CradleME in this program. We do in the homes, we're doing the ages and stages assessments, and we're sharing those with all parties. We also attend state committees and have input into and a voice for our patients as well as providers and the best way to care for these families and services. Our team serves on the members of the maternal, fetal, and infant mortality review panel. I've been fortunate to be a part of that and really to be a voice for the people that are no longer with us and the families and their stories. We work with the families to identify domestic violence and offer support. We teach safe sleep. We do the depression screenings. We teach families and caregivers about the period of purple crying. We also have the Crib for Kids program. If a family is going home and doesn't have a safe sleep area for the child, we can provide that for them. Thank you. Next slide. These are other ways we support. Again, growth and development. A lot of the infants come home with failure to thrive, or they're at the pediatrics office, pediatrician. Those are times to also think of public health nursing, not only at birth or prenatally. It's through to the infant's first year and on more if indicated. And again, we teach some car seat safety, make sure they have a safe way to transport them. And we also start discussing before they return to work or how they're going to deal with childcare and nursing and other important life journeys that they're facing as a parent. Our next slide. This just it goes on every visit. That's why we chose to do this throughout the year. We always reassess about domestic violence, and we reassess about safety and mood and growth and development. So every visit, these are getting looked into or asked if there are any changes, as changes happen a lot in these families. And so this is ongoing every visit, and generally every partner that they would work with. We're all looking at these things. The next slide. So who qualifies for the CradleME referral system? All pregnant and parenting individuals and families in Maine. It isn't only for substance affected families, it's for all families. So there'd been time in our rollout where that got confusing and we wanted to know lots of information, but every newborn in Maine deserves a visit, as well as every parenting family. So there is no qualification other than the patient's willingness. That would be the most important piece. We're free. It has to be voluntary. We can't be really ordered. It's a voluntary process. And it's free of charge. There is no charge for any of the services. You may have some qualifications for some of the specialty services, but as far as the CradleME public health nursing and Maine families have no qualifications. The next slide. How to refer to CradleME. We're trying to make it as easy as possible. We have a web page. You can download our form and complete it. You can call us, you can fax to us, and you can email to this email link as long as you encrypt your email. So we'll also take it verbally over the phone. Anyone can refer to us. This is it could be a patient can self-refer and call us, and we'll answer the call. Our process is to reach out to the families within one day. So one business day, of course. We're not on for the weekends. Oh, I do see that. We have worked with interfacing the CradleME form within the Maine health system, and we are open to working with any health system. And we have been called by Northern Light to partner on this as well. So reach out to us at any time if you'd like to work on having this be part of your record. Thanks. I saw that pop right up. Thank you. Next slide. The supports that you can get on CradleME there are 5 disciplines, and you can have one or all of them if you qualify or are interested in the program. WIC, of course, if you don't know, it's the nutritional program for women, infant, and children. Maine Family Home Visitors, that program is in person as well, and for families, and they work with families up to 3 years old. So this is a long term, and usually the same worker. It's really important. We'd like to partner everyone to have a home visitor for those young years. Of course, public health nursing, and then early intervention for me, also previously known as child development services. They are also on our form because all substance affected infants automatically qualify being born to be offered this screening and services to the family once the infant is born. And then MaineMOM, any mother, provider, anyone who is treating families with opiate use disorder would know that we are going to connect folks to a MaineMOM. If you call CradleME, we will help you find a MaineMOM provider across the state. We will work with you to get treatment. We're just the door to get you to the right place. And it doesn't matter if you start with public health nursing or WIC, we're all going to look out for the whole patient. What do they need? What supports, and where are they in the state? And we're going to make sure to get them connected. Next page. This is the CradleME form. It looks busy, but if you go to our website, you can download that. It's fillable. We haven't been able to complete making it a completely fillable online form yet, but we do have goals to do that. We really need their name, date of birth, and contact information. It's designed for the mom to fill out or the family members to select what they're interested in. And often many of you may be asked, what are these services? So we've made it so that there's a brief description there. They can choose. And the real message for folks as you're talking about the CradleME referral system is that by selecting this, they're just really giving us permission to call and to allow us to talk about the program and how we can help them. It doesn't mean that we're going to go visit in their home. It's their choice. We're going to call and say, congratulations, and how can we help you? So we will be happy to give them more information. And sometimes I'd urge folks to think of it that way, that we'll explain the services to them when we call and we offer it, and they can refuse it. It's completely voluntary. And what's changed recently that's of most importance to folks is that if they don't opt out of the bottom box for Maine families, every CradleME referral will get a Maine families visitor phone call, which is really just to be sure we offer everyone the opportunity to have these services and support. There is a part on the bottom about Family First that I'll talk about a little bit later in this slide. Next page. So this page is really only if you're requiring a public health nurse. If you want to complete this, we would appreciate as much information as possible. We do not send this second page to any other partner. It only goes to nursing. So from a nurse to nurse report, we would appreciate all the medical information possible so that we can be better prepared to support the family. And when you do send it along and we get this second page, the page gets separated and medical information is not shared with WIC or Maine Families or any other partner other than a nurse. So that was added years back so that we could better understand the referral and be prepared to bring the support. The next page. So when the infant's born reports are made, and it's different across the state with the reporting, whether it's opiates, marijuana, alcohol, these reports are reported if the infant was affected or is affected at birth. So how we become involved is they're asked about that at the hospitals. Do you want a CradleME referral? And we work with the Office of Child and Family Services, and they send along information, and we plan outreach with them. We get the referral just like every other referral. We assign it, and then in collaboration with OCFS and MaineMOM, we also allow now that when the social workers and nurses are talking about making this OCFS report, they can also offer up, if they want, the MaineMOM services, the models of care in their community. So we help make those connections also through the report that gets made from the hospitals. Next slide. Family First is only used for internal use. We just want to talk about it because it is on the form. And basically, this is an added program for families who are at risk with the offset of losing their family and not being successful. So caseworkers help with the older children up to the ages of 5, where the maternal child health program is up to the ages of 3. This program is designed just for the Office of Child and Family Services to refer. And we just manage those referrals through the CradleME process. That's why it says internal use. Thank you. Next slide. Early intervention for me is also on our form. Substance affected infants automatically, as I said, are eligible. There is an established condition list, and that's been added to it. There's been some collaboration with CradleME and this program to help prenatally get the message to the moms that we're a service that can be available to support them once the infants are born. And elder, my goodness, I see the early intervention for me program is up to 3 years of age as well. Next. So the CradleME referral system is also a pathway for moms living with the opiate use disorder or are in recovery. MaineMOM will support the mom prenatally, and many of you are providers up to 1 year after the child is born. Our role is to connect these families to the MaineMOM providers in their areas. And we're also, we've become part of knowing about the open beds, and if we can help be a catalyst to earlier interventions. We have had moms call us who had just actively used and wanted help at that time. Often they're told to go to the ER. We're just happy to be a part of this, to be another place where they can call to get them to where they need to be. The next slide. We'd like to promote the plan of safe care. That is a really excellent tool to help moms and families identify what supports they want. There's a portal now. Um, there's an online portal where all the providers would be able to go access it and see what's been most up to date, what their teams they're working with and their needs. If you aren't familiar with it or need any guidance, of course, Stephanie Truman is our Plan of Safe Care nurse, but we'll also help direct anybody with that. And we promote this and are trying to have all of our families be prepared before birth, have a plan of safe care completed. Thank you. The next slide. This comes right from the Plan of Safe Care website. And it really, if you just take a few minutes to read it, this is the message. And what I like most about this is that talking about a plan of safe care is talking about how can we better support you. So if you're going to have the mandatory report talk, you can also talk about support and that this is what we can do to help you. And I think when I learned about the plan of safe care, I put that in line that mandatory report is really a mandatory support. And that is what I feel the plan of safe care helps us get people engaged with it is we want to better, and it helps a mom understand their team. Often they have many care managers, many care providers, and they're not even sure who they are. And this tool also can put names and numbers and help them better understand their services. So it's just a great tool, and we do promote it and want folks to make sure that that's how we can help these families is getting them connected so that they can feel successful. And what, of course, my last slide is next slide. Yes. I believe it's just the plan of safe care. If you hadn't seen it, it's kind of talking about what do you need and what do you already have in place so that we get them better aligned with their needs. And now in closing, I would just, as I was getting ready to make this presentation, we got a comment from a nurse that I thought was really important that I wanted to share to sum up kind of what public health nurses do and how our role is in the field with them. And a nurse, Colleen, who works with the folks, said, I truly love it. I love working with these families. I take the approach of meeting clients where they are and providing non-judgmental care and support for feeding, answering questions on health and development, and connecting resources if needed. We use Eat, Sleep, and Console as a good tool to help families with their substance-exposed infants. The clients with substance use disorder have often said how stigmatized they feel in the healthcare system. So as a nurse, she thinks that one of the best things we can do is to be trusted healthcare providers where they feel like they can ask questions and be cared for in a non-judgmental space. And thank you all for listening.